Let's start with John. John, welcome to the show.
Hey, it's good to be here. Thank you.
Glad you're here. A little background on yourself. You've been you're the executive vice president, strategic development and partnership, but beyond that, you've got some depth that you bring to the company. Give us some feeling for who's leading the ship and who's helping this wind your company into such success that you've had so far.
Sure. I appreciate it. So, Intiva Health was born actually out of a practice management company here in Texas. We actually still own it. We manage anesthesiologists in a number of facilities here in Texas. And about 3-4 years ago, it became very evident that one of our major cost centers and one of the things that was a real struggle for us as an organization was efficiencies in getting physicians to work, to get them on the schedule. Because once we accept them as their application and say, hey, you're great to work, we still have to get them privileges at the facilities, and that is a very arduous process. So they developed a software, and then they needed some expertise to begin forming strategic relationships, and that's where I came in. I've been an entrepreneur for almost 3 decades now, and done a number of different ventures. Everything from I owned a number of a network of ATM machines in California and Arizona back when that was a very interesting business to be in, and then exited that, and then I was in consumer electronics for a while, and had a couple of different ventures there, and sold those businesses, and was looking for kind of my next project, and they approached me to build out their business development and sales arm, and that's how I came to be with the company. And we have some excellent talent from the medical space, which Gary McIntosh is our COO. Sean Friscio has been in medical tech for many years, helping us develop the platform itself. And it's very important with what we do that in the medical space, there are so many stakeholders, so many different layers that it's critically important to understand how the system operates in order to apply a technology solution to it.
Now, talk to me about security and credentializing challenges in the medical industry, because I know that can be daunting.
Absolutely. And actually part of the conversation that we're going to have today is regarding the idea of how blockchain and blockchain-based decentralized ledger technologies is impacting in a huge way the medical space. And part of the problem, as you know, with the medical space is that it's antiquated. And part of that is because of all of the regulation layers that are imposed regarding patient information. Everybody's familiar, most people are familiar with HIPAA, or at least they've heard the word. And so communication regarding patient information is heavily regulated, including the technologies that surround that. And because of the patchwork nature of the organic kind of nature of how technology has been adopted by the medical industry, it creates a lot of security vulnerabilities. And so that was something that we were keenly aware of when we began the process, and we started to look for blockchain technologies that we would be able to utilize for security from the decentralized nature of blockchain, as well as for the verification portion that we were attempting to achieve with credentials. And we were able to, we met with a company called Hashgraph. At the time, it used to be called Swirls, but they're Hashgraph now. And Hashgraph technology allowed us the capabilities we needed with a decentralized ledger technology, blockchain-based type technology, to do what we need to do with speeding up and automating the credentialing process for physicians.
Yes, I had him on the show, and I was very amazed. I'm trying to get back to him because that technology is going to change the world in so many ways. Yours is one of them. You also have a way of using this technology to benefit not-for-profits. Talk to us about how that's working.
Yeah, absolutely. So part of the platform, first thing to note is that we'll be one of the very first Hashgraph integrations on the market. Actually, we will be the first integrated enterprise Hashgraph solution that will be coming out in midsummer. So that's very exciting. Additionally, the platform is focused on licensed medical professionals. And we will have the very first tokenized economy, which is actually a cryptocurrency-based economy that rewards physicians and nurses and nurse practitioners and mid-levels to use the platform in order to streamline and automate the credentialing part of their the administrative part of their journey, their career journeys. So things like, hey, most people aren't aware that physicians are required to maintain about 25 to 30 different documents every single year from different, multiple different sources. I mean, we have to deal with our, driver's license, for example, and you know what a pain that is just to get that done if you have to go to the DMV. Well, imagine that 25 different times or 30 times with a bunch of different bureaucracies. Well, they have to do that every single year as part of their requirement to practice medicine. So what we do is we've built a platform that streamlines and automates a lot of that process. Additionally, with the integration of Hashgraph, what that allows us to do is to create a verification system with the interface for the credential management. And so currently, right now, if you were to try to go and start working at like Dell Children's Hospital in Austin, Texas, for example, they may say, hey, this is great. Come on, your application is approved, but now you have to get privileges. So send over all your credential information. And you do that as a physician, and then you wait. And that process for them to actually go through and verify every one of those documents takes months because somebody in an office somewhere is picking up a phone or checking online and calling around all your references and saying, hey, was he here at this time, or was she here, was she at your university from this time to this time? And they literally go down and start checking marks off of a box. Our system with the Hashgraph integration, the system itself verifies those documents when they enter the system, and all of the facilities and groups reach a consensus that, yes, that doctor was there at that time, and now we have an instantaneous credential verification that is then date and time stamped with an immutable, legally irrefutable date and time stamp through the Hashgraph blockchain system. And now you completely change the way that credentialing is done in the United States healthcare system.
John, I'm sorry we've got to go. I haven't even scratched the surface on my questions, but thank you for being a guest on the show. Hey,
really enjoyed it. Really appreciate it. Have a great day.
You too. John Hartigan, Executive Vice President, Strategic Development and Partnership, Intiva Healthcare, intivhealth.com.